We're talking to Ms. Patricia Lockett, who is the Assistant for Social Services for the Department of Human Services. And let me welcome you to Black Pulse, Ms. Lockett. Ms. Lockett, child care has been in the newspapers quite a bit, quite recently. And as we indicated in our introduction, it's sort of a political issue about this time. And I think it might be best, representing the state of Tennessee, for you to give us some information relative to the impact that child care has had upon the Department of Human Services and what the state is doing in reference to child care.
Well, I think, first of all, it is a major issue, and it's a national issue today, given the fact that we have pending legislation, federal legislation, that addresses that as an issue, which brings that into the arena of public policy for the first time. And I think that's the real significance of the federal legislation, is that for the first time in this nation, we have serious public policy on the national level in regard to child care. Now, looking at the state and what the state plans to do, I think that it would be very difficult for the state and the nation, for that matter, to ignore the needs for child care in this country today. That's very difficult to ignore that as an issue.
Well, now, how long has the state been involved in child care on that level, Ms. Lockett?
Well, I think for many years now, the state of Tennessee, as well as most states, have provided resources in the form of child care. And as you know, we've had a role in child care for many years longer than that, in that we are responsible. The Department of Human Services is responsible for licensing child care facilities. And we have always had that as a responsibility, and we carry that out, whether that program is involved directly with being funded by our department or not. But we also provide, through our social services block grants, monies to fund daycare programs.
Now, these monies will go to the various counties within the state?
That money goes to the various counties, and through a process that has been in operation for a number of years now, those local counties decide through a social services advisory council, they identify their need, and always child care is a need that has been identified by them. And they utilize their social service block grant allocation that comes from the state to the local areas. A portion of that has been used for a number of years for daycare. We fund about 38 child care programs throughout the state through what is referred to as social service block grant monies. And in addition to what we fund through that process, we also have additional slots of daycare that we fund through a vendor reimbursement rate. So individual vendors are reimbursed for our department to provide care for children who are either in our custody or children who otherwise are in need of child care whose parents cannot afford to pay for that care.
And so the state has a long history in terms of dealing with the child care issue.
Yes.
Now, the state has also entered into a new phase in terms of its relationship, and that has to do with the child care facilities. Perhaps you could say something about that.
Yes. Our department opened the early part of this year an employee child care facility, which now operates in Davidson County and provides care for employees within our department. Now, this is a new venture for our department, and one that we're very proud of, that is being operated on a pilot basis at this time, looking at that to see the rate of utilization, and the response has been very good. But that is I think, the department's way of responding to that need, in that we know women who work certainly need child care, and they need quality care for their children.
Now, the state's role in terms of dealing with the federal government in child care has always come through essentially the Department of Agriculture. Is that true?
Well, our own department receives the social services block grant money, which is a block grant to our state, $57 million our department receives each year, or at least that's the rate that we now receive.
So that money is already laid out in the budget?
Yes, and that money is, a portion of that money is utilized by our department through the allocation of those resources down to the various districts. and some portion of that is being assigned to pay for child care. Now, what we have said recently, we have established a priority for the development of more daycare, and we're specifically looking at the areas that we have identified where we know there is need. There's a need for more infant care. There's a need for care for handicapped children. Those are the areas that we can very quickly identify based on what we know the need to be at this time without further research of the matter. Therefore, we are telling the districts and trying to encourage them to work with their local communities to develop more care for infants and, of course, more care for handicapped youngsters, which is the most expensive kind of care. But it also, we have clearly identified that there is a need for that kind of care. We also need more full-time care. We have already researched and know that of the some 308,000 slots of child care in this state, that about half of that care is not full-time care. That is care that is being provided on a partial day basis or before and after school care, or where parents bring their children for a portion of the day, and it certainly does not begin to address the needs of working parents.
So there are many, many gaps in even the
Yes.
care that is now provided
Yes.
in terms of what we are now providing.
Because as you said earlier on, we know, as a matter of fact, that more women are working. It is estimated, based on the most recent census, that of the women who work and are in the workforce today, 70% of them say that it's an economic necessity that they work. Therefore, women aren't working simply because they want to be out of the home, or they're doing that because they enjoy being away, but it is now an economic necessity that they work.
And so consequently, we bring more women into the work area.
As we bring more women into the workforce, somebody has to be responsible for their children. And we've also know, as a matter of fact, that 51% of Tennessee's women who are in the workforce, 51% of them have preschool-age children. And those preschool-age children, of course, have to have care provided them.
Very good. Let me thank you for coming by and talking about this very, very important issue with us, Ms. Lockett. And we'll be back with you following this commercial break.